Prescribing opioids can be risky. It's not enough to just understand the clinical guidelines that keep patients safe, but also how to include the necessary chart documentation. But what is necessary chart documentation? Well, the answer lies within the phrase legitimate medical purpose, which is found in Title 21 of the Code of Federal Regulations. The problem is finding the definition of legitimate medical purpose is no small task. It isn't defined by the federal government, and most states at best have very vague language when addressing it. That leaves healthcare providers in a pretty scary position, prescribing opioids in the deadliest epidemic our country has ever seen and only guessing at whether their patient charts are documented properly. That is until now. Introducing the Care Continuity Program by SureMed Compliance, the first and only program designed specifically to help opioid prescribers determine and document legitimate medical purpose. Through examining state and federal case law, SureMed Compliance uncovered several unique data points that played a role in informing whether or not a prescription was legitimately written. We then organized the data points into protocols, many of which can be accessed by the patient outside of the doctor's office prior to each visit. The result is a time and date stamped report that can be added to the patient's chart, helping establish legitimate medical purpose and mitigating prescriber risk. If you prescribe opioids, don't wait until your charts are pulled to find out whether they are documented correctly. Prescribing opioids can be risky. We can help. SureMed Compliance, changing the culture of opioid prescribing.